All right, let's get started. Well, welcome to everyone who has joined us this morning at our virtual Tocqueville breakfast. Our name is Mike and Yun Hee, and we are the chairs of the Tocqueville Society. We're grateful to have you and looking forward to hearing from our incredible speakers today to gain unique insight into Colorado's vaccine rollout strategy, the impacts and trends that we are seeing in our community, and the important collaboration between the public health, and the nonprofit sectors in tackling this ongoing crisis.
Thanks to everyone that submitted questions upon your registration. We also invite you to ask questions or share any reflections through the chat function of Zoom, which is located at the bottom of your screen. Please do so throughout the program.
Great. Mike and Young Hee, thank you so much, and good morning to everyone. I am Christine Bonero, and I have the privilege of serving as the president and CEO. And Mike, I realize this is why it's Zoom. We got to go back a slide, Corey. The most important thing, we have to thank our sponsors. Mike, I'm sorry I stepped all over you.
No, that's all right. We were just going to go with it. Before we begin, we do want to thank our Tocqueville Society sponsors. On the screen are listed Davis, Graham & Stubbs, PCL Construction, KPMG, and Kaiser Permanente. Thank you very much for your incredible support. We're also very grateful for all the partnerships with our corporate partners and with each of you, our Tocqueville Society members. Thank you very much. From those of you who may be new to us today, we hope you'll consider joining this amazing group of business leaders, community activists, and philanthropic leaders as part of our Tocqueville Society. Now I'd like to pass it on to Christine Bonero.
Thanks, Mike. We're going to get this. I like it when we're in person and can really figure out how to do this. And my sincere thanks to Mike and Young Hee, who have continued through this very challenging time to continue to lead us, to inspire us, and to inspire our Tocqueville donors. So thank you so much to both of you. And I really am. I'm like Helen. I'm counting the minutes until we all can be together. There is no more timely topic, I think, than what we are going to be lucky enough to speak with three experts this morning. Before you all joined us, we were having a little pre-speaker conversation about how fortunate we are to live in Colorado. We all have known that, but this past year, with the way our community has come together, from our leadership, from the governor to the leadership in the healthcare industry and our hospital partners to the nonprofit community. It has been a challenging time, but as our governor said, we're going to get through this together, and we have. We still have challenges, we know, ahead of us, but when you look at the three leaders that we're going to have a chance to speak with this morning, it really does give me hope about where we're headed and what's next for our community. I'm privileged this morning to be able to moderate and introduce our three speakers, and to encourage all of you, if you do have questions, please put them in the chat. And many of the questions that we're going to be asking this morning have come from all of you as well. So let's get right to it. And again, I have the privilege of introducing three really amazing speakers. Our first speaker this morning, our panelist this morning, is Rick Palacio. Rick is a sixth-generation Coloradan who was born and raised in Pueblo. So great stories, I have a feeling, Rick, that your family can tell. The son of a steel worker and a homemaker, his family roots are in the southern part of the state, where both of his grandfathers were coal miners. Before serving as the chairman of the Colorado Democratic Party, Rick worked in a variety of roles in Colorado and in national politics. Rick was elected the chairman of the Colorado Democratic Party in 2011 and is the first Latino in Colorado's history to hold the office of chair of a major political party. And when he was elected, was only the second in the entire nation. During the COVID crisis, Governor Polis called on Rick to serve as interim chief of staff, and he is currently acting as a special advisor to the governor, where he has become focused and is leading the way on equitable distribution of the vaccine to Coloradans and leading the way to help our state recover. Rick, we're so grateful for you, for your leadership, and for joining us this morning. Thanks so much for joining us.
I'm glad to be here, Christine. Thank you so much.
I am also very privileged to introduce to all of you Dr. Connie Saver-Price, the Chief Medical Officer at Denver Health and Professor of Medicine and the Division of Infectious Diseases at the University of Colorado School of Medicine. Prior to Dr. Price's current role, she served as the Chief of Infectious Diseases and the Medical Director of Infection Control and Prevention at Denver Health. Again, a jewel in in the Denver community. Dr. Price is board certified in internal medicine, infectious diseases, and medical microbiology. Her research and clinical interests have been focused in healthcare epidemiology and methods to prevent and detect rapidly detect emerging and antimicrobial resistant infections. Okay, I worked on that, Dr. Price, but thank you so much for joining us this morning as well.
Thank you so much, and you practiced well.
Thank you. And finally, certainly last but not least, my colleague and dear friend, our very own Wade Treichler, our Chief Operating Officer at Mile High United Way. Wade joined the Mile High United Way team in 2016 as our Senior Director of Technology, where he very quickly advanced to Vice President of Technology and Facilities in 2018. And in 2020, we were very proud to name Wade our Chief Operating Officer. I'm not sure this is the year he wanted to do that, but there we are. Wade leads the Technology, Facilities, and Operations team in supporting and streamlining our day-to-day operations and ensuring, most importantly, the ongoing mission of our work in our community, particularly overseeing our 211 program, who is, as you all know, delivering key resources in our community by handling more than 120,000 phone calls in 2020. With more than 17 years of experience in IT, communications, and facility management, we're very grateful to have Wade on the team. I don't think we could have gotten through this year, Wade, without you. So thank you to all three of our panelists this morning. So one of the things I think that we all always inherently knew, and then through amazing data that Phil Chung and Tim Main put together at the evaluation team at Mile High United Way, our Board of Trustees has always said, we need to be data-driven. We need to understand what's happening in our community. We understood this pre-COVID, that each family is impacted differently and that neighborhoods are impacted differently. So we put together pre-pandemic looking at maps at what are happening in neighborhoods. And we looked across our 7-county region, looking at things like income levels, unemployment rate, education levels, and the availability of childcare. We were able to identify those neighborhoods that have been under-resourced and are experiencing some of those higher rates of the what we've learned to talk about, the social determinants of health. And so we look at this community need index that the communities most impacted are those communities in reds, that the needs are higher. So I wanted you all to take a quick look at this map and then look at the second map. Just like the community needs index map, we've seen that COVID has impacted, again, individuals across the 7-county area in very uneven ways. The neighborhoods that we already had identified as facing the greatest challenges before COVID have taken an even heavier hit during this time. And in particular, the Tocqueville Society, you all know as well that our work in the Globeville, Elyria, Swansea neighborhood, where we have looked at our place-based strategies, have been really among, again, the most highly impacted neighborhood to be hit by COVID. And again, these are the families that have low to moderate income levels and are home often to more, or not often, are home to more Black and Latino residents. So what we know is the need is the greatest in our most impacted communities, which is why we're so very grateful for our panelists today to help us get both a macro and a micro view of what is happening. Again, I know some of you are putting chats and questions, but we're going to go ahead and get started. So all three of you bring, all three of our panelists bring very particular vantage points from where you sit and what you've been doing. So I'd be very interested in starting this morning from your particular lens of what is the pandemic looking like in our communities, and what is the thing that has surprised you most up to this point? And as we roll out the vaccine, what is that meaning for these communities? So if we may, Dr. Price, I'd love to start with you this morning. And again, thank you for joining us.
Sure, thank you. So, what we are seeing in the hospital is really what you showed. What the patients coming in are often from these under-resourced or under, these neighborhoods that have been struggling even before COVID. And sometimes we'll see entire families admitted. And many of these patients coming from these areas also seem to be sicker. They require ICU care. They require more intensive hospitalization care. And often it's because they also have a lot more comorbidities that make them at risk for more severe disease. So that's one of the very personal and hard parts of what we see in the hospital that has really impacted all of us as healthcare workers throughout this pandemic.
Thank you. Rick, what are you seeing throughout Colorado?
Sure. First off, let me just thank you for having me this morning. Mile High United's Way has been really a tremendous partner in these very challenging times. And we are truly grateful for all of your leadership. We also know that this has been incredibly challenging for everyone, not just certain Coloradans, but every Coloradan. We've lost family, we've lost friends, we've lost a lot of loved ones to this deadly virus. And as we approach the 1-year anniversary of the first case in Colorado, I think it's good for us to stop and really take that in and really honor those that we have lost. Some of the observations that we've had is that Coloradans really have shown our ability to come together. As I said, we know that these times are incredibly challenging, but people really have stepped up. In the beginning, our healthcare workers, our first responders, our grocery store workers, local public health, our hospital partners. I think there are no shortage of heroes in this pandemic, and I think it's important that we realize that it's not just those people who are on the front lines. It's not just our ER docs or our ER nurses. It's even the people that are cleaning the rooms afterwards, right? It's the people that have put their lives at risk to make sure that we have food. So when you ask, what the observations are, I think one, everyday heroes. When we talk about what we would like for the audience to know, I think we're going to get through this. We're going to build back stronger, as the governor says, and we're going to come together. But one thing that I think is incredibly important is that Dr. Price knows well, this pandemic has only further illuminated the stark inequalities that Coloradans of color and those in underserved communities face.
Rick, thank you. Thank you. And Wade, I know that at Mile High United Way, we have been seeing firsthand through our 211 call center. What's your perspective been of what you've seen and what we've learned?
Thanks, Christine. Like you said, we have the opportunity to hear the calls and see the data that's gathered by our 211 Help Center navigators during each call from community members who reach out to us in need of resources for themselves and their families. These calls spiked tremendously last year, and I think one of the things that's really stood out to us is the prevalence around food insecurity. We've supported an incredible spike in enrollments in the Supplemental Nutrition Assistance Program, also known as SNAP. And I think what we see is COVID is really affecting families who were, like Rick said, already on the brink of poverty, and who now, without support of basic resources, may find themselves in a very perilous situation. Knowing that this is a rapidly growing need, in partnership with the city, state, and we're able to distribute rapid response grants focused on food insecurity and other basic emergency needs to support this emerging issue. I think the other thing that surprised us is the integral nature of childcare and early childhood education and making the economy run. When the schools close and students have to do remote learning, and when childcare centers are forced to close their doors, what options do parents and caregivers have? How do they work? And if they can't work, how do they pay the bills? We saw the need for childcare increasing. We learned that childcare centers weren't able to keep their lights on due to lack of funding or supplies to safely do so. Through partnerships with state and other foundations, we established the Keep the Lights On Fund to help childcare workers or childcare centers continue to offer their services safely, and then connect with them through 211.
Great. Thank you, Wade. And again, thank you. I've been privileged to watch your leadership and our team's leadership in all of this. So, Dr. Price, we all watch the news. We all stay glued to our computers to look at what's happening with rates of infection and with the vaccine. So, and we know it's changing on a rapid basis. So, what is currently happening within Colorado?
Great. Well, thank you, Christine, for asking that. So I have a slide I just want to show you. It's a better visual. If you can go to, yes, this is the one. So what you see here is the epi curve since the very first cases of COVID in Colorado. So you can see we're going back to around a year ago today, March 5th, 2020. Remember, we didn't have a lot of testing, so we have some underreporting here. Here, as testing became more plentiful, you can see a more accurate representation of rates and what we have in the latest wave. But even with all the testing resources we have now, we're getting close to what we call the nadir, the lowest point of the pandemic since it started. So we're going the right direction. Next slide. So the other thing that's really encouraging is that we have more people getting vaccinated. So on top of those who have experienced infection and survived, we've been able to provide vaccine to have more what we call herd immunity. Basically, this is our key to getting out of the pandemic. When we have a certain proportion of the population who's immune, either through natural infection or through vaccine, that's how we can stop the spread of this. So these are data from the state, which I agree, our state has been amazing in both the transparency in data and in this vaccine rollout. But here you see the first Pfizer vaccine, which is the first one Colorado received in the blue, and then on top of it, the Moderna vaccine, which is the second vaccine we received, and increasing rates of vaccine to the point where we have given a total of over 900,000 vaccines, at least one dose, and then almost 500,000 people in Colorado received 2 doses. So I believe that equates to about 16% of our population. We still have a long way to go, but we're getting there. And with the news of the third vaccine coming, I'm optimistic that this is going to increase even faster. And I think I have one more slide on this topic. Yeah, so this is the information about our J&J vaccine, Johnson & Johnson, also known as Janssen, the Janssen product. So last week, the FDA issued an emergency use authorization for our third vaccine. And what we know about it from the clinical trials is that it's 85% effective at preventing serious illness. And that's as good as many of the vaccines that we have today. In comparison to the flu vaccine, which maybe is about 50%, this really is a very promising result. And although the other two vaccines reported higher efficacy in their initial trials, please keep in mind that these vaccines were trialed at different points in the pandemic in very different geographic areas. So I don't want anyone coming away concluding that one vaccine is better than the other. We do know that this is a really effective vaccine. Now, looking overall, when even moderate illnesses were included, we had a 66% efficacy in this vaccine overall, higher in the US population. And part of what brought those numbers down was the emerging highly communicable strain in South Africa, which was a big part of this trial. The biggest thing, the most exciting thing about the J&J vaccine is that it's single dose. So we don't have to bring people back. Sometimes that's hard with some of our populations, and we can take it out to the field where the people are. And because it doesn't require this ultra cold storage, which really, when we have that requirement, we have to bring people to us, and that's not always easy for everyone. So we really like this for our outreach and our homeless populations. Perfect vaccine for them.
I have to tell you, Dr. Price, seeing those trends and hearing you speak about the vaccine, I think all of us are just feeling hopeful about where we're headed and how we may get there. So Rick, I know that this is what you have been thinking about 24 hours a day to think about all of Coloradans. So can you talk to us a little bit about the rollout and which we ultimately know that it will lead to the recovery for all of us and for our state?
Sure, absolutely. I want to add on to something that Dr. Price said about the Janssen vaccine, which is incredibly exciting. I think, number one, of course, because it does not have the shelf instability that some of the other vaccines has. Of course, that it's one dose, but I think it's important for people to know that while the efficacy is a little bit lower than the others, and I think Dr. Price pointed out 85% of serious illness is prevented. I think that the percentage of those people who prevented death is actually incredibly high in all three of those vaccines. So we want to make sure that people don't feel like if they get the Johnson & Johnson vaccine, that they're somehow getting a subpar product, because all three of them really are doing everything they can to prevent death, which, as we know from the beginning of this pandemic, has really overwhelmingly hit our elderly population, our folks that are in congregate living settings like nursing homes and long-term care facilities. So at the beginning, as soon as we knew that we were going to get vaccines in Colorado, we began earnestly putting plans together to vaccinate those that were at greatest risk. We know from data that about 78% of people in Colorado who have died have actually been over the age of 70 years old, which is why we began to create the prioritization that we see now. The 1A priority was those in long-term care facilities and frontline first responders. And we are incredibly happy to report that nearly 100% of both of those populations have been vaccinated. I should say, everyone who wants a vaccine in one of those two categories has been able to get a vaccine, which the recent data now shows that while at one point in time, a majority of our deaths were coming from that elderly patient population 70 and up, now it's actually the smallest population of serious illness and death, even smaller than children under the age of 9, which is really, I think, something phenomenal, something that we can all be incredibly proud of. So what we have been doing is focusing on goals, saving as many lives as possible, and we need to do it quickly, which means that our goal is to get vaccines out at the end of every week. And really, we need to just end the crisis that's been brought on by the pandemic. So what that means is, let's acknowledge that this virus is going to be with us for a very long time, but it doesn't mean that our lives need to be disrupted for just as long. So the quicker that we could get virus into arms, the sooner that Coloradans can get back to some semblance of normal life. We're probably all going to hopefully be wearing masks for a very long period of time, because mask wearing, social distancing has been incredibly effective at preventing transmission. But as soon as we get vaccines into arms, we can get back to some sort of semblance of normalcy, which is really, I think, important, not just for the economy, but for mental health, for general health as well.
Thank you. Thank you, Rick. I am going to take a couple of questions that we have gotten from the from our audience today and try to weave them in. Jonathan Davidson, hi Jonathan, asked a question, and Rick, you alluded a little bit to this around first responders and healthcare workers, but Jonathan's question is, he understands that some first responders aren't choosing to get the vaccine, and have we done or any research, or Dr. Price, of perhaps why they're choosing not to?
Well,
Yeah.
it is an issue, and it's mostly highlighted in law enforcement, some corrections where the uptake is a little bit lower. When you get into medical fields, then the uptake is quite a bit higher. I think we're in the process of trying to determine what is behind that hesitancy. It is important because as this pandemic goes on, it'll be all the more important that we have those vaccinated who actually have interactions with people. So whether that be in corrections or whether that be in law enforcement, it'll be important that we are able to convince them that the vaccine is safe and that it's something that they should be doing for their communities and their families.
Thank you.
And
Thank
Dr.
you.
Price, I stepped on you.
No, that's okay. I think what we're seeing initially when the vaccine was rolled out with some of our healthcare workers, we did a survey of all of our providers on their willingness to take the vaccine. And I think this probably translates to the long-term care facility situation as well. But initially, people were more hesitant. And then as time went on, and as they saw more people getting vaccinated, and as they learned more, and they saw the data, there was more of a willingness over time. And so what we saw in our medical staff is most of the physicians, 90% were willing to take it, a little lower on nurses. And then as we went into the different types of workers, more hesitancy. And we did see some ethnic differences as well that produced more hesitancy to get the vaccine. But again, with some targeted efforts, we've been able to increase that to the point where we're now at about 70% of our entire workforce has expressed willingness and has generally received the vaccine.
Thank you. I think just for me as a lay person, I feel like I've learned something new with the facts and the data. And again, have been so grateful to be in Colorado. I shared with Rick and Dr. Price that my colleagues across the country are not having the same experience in their state around the transparency of data and the facts and the information. Dr. Price, Helen Drexler wanted to go back and ask what herd immunity really means. And is that a certain percentage, or what actually is herd immunity?
Yeah, so it means it's a percentage of the population basically required to make the transmission stop. And so with a vaccine efficacy of around 90% when you average everything together, we would need about 70% of the population to be vaccinated. And that's achievable. We know we can do it with vaccines like measles, mumps, rubella, which is about 90%. So with this, I think we can achieve it. Now, a lot of it's going to depend on, do we need to do this every year? That is going to impact our ability to succeed. But if this is a one-time thing, then, we can get to 70%.
Thank you. Thank you. Rick, I know you and the governor spend every day looking at the actual data of what's happening in Colorado. And we've heard recently, and we're watching those trends come down. We're also hearing recently that perhaps, and this is a question from Tom and Barbara Burke, and maybe this is for you too, Dr. Price, are less people getting tested, which could be one of the reasons why we're having less cases?
Yeah, so the way we look at that is really in the percent positivity to account for the the possibility that fewer people are being tested. And that's a nice indicator. That percentage is also going down. So we are, I think, about 3% now, which is really as low as we've been through this pandemic. There have been times where about 20% of the people who opt in for testing would be positive. So this is even on a percentage basis, the rates are going down.
Thank you. Thank you. So Rick, a question for you, because I know you are developing strategies for our entire states, all of our communities, all of our neighborhoods. And then when we looked at those maps at the beginning of the Tocqueville Society, we know that there are some neighborhoods that are under resources. What type of strategies are we as Coloradans developing to reach all Coloradans? And ultimately, what is success going to look like?
Yeah, great question. So let's think of some of the goals that we have had, and Dr. Price just mentioned that herd immunity is reached when you have approximately 70% of a population immunized. Just this week, actually, on Sunday, we reached a milestone goal, something that in the governor's office we call a WIG, wildly important goal. At the beginning of vaccine distribution, we set a WIG that 70% of Coloradans 70 and older should be vaccinated by the last day of February. And unofficially, because it does take a few days to get vaccines reported from our providers, unofficially, we vaccinated 70% of 70 Coloradans who are 70 and older, which of course, as I mentioned before, accounts for 78% of the deaths that we've had in Colorado. So that's been incredibly an important goal that we've been working towards. As I mentioned as well, vaccinating our healthcare workers who work day and night to save lives. We're at 90%. We have offered vaccines in 100% of our long-term care facilities, and that includes both the first and second doses. And right now we're focusing on vaccinating our educators and people over 65. Our educators are, of course, incredibly important because the well-being of our children is incredibly important, number one. Number two, we have women in the workforce rates that are abysmal. We have dropped down to rates that we've not seen in this country since, I think, 1984, which means that more families are staying home, more mothers are staying home. And of course, single mothers, many of them don't have a choice but to stay home with their kids. So vaccinating educators so that we could get back to school is an incredibly important goal as well. We talk about inequity, and I mentioned how we need to make sure that as we distribute vaccines, we're doing it in an equitable way. What we've targeted is that we should have a pop-up clinic in our census tracts in our small communities that include the highest percentage of low-income seniors of color. And we've done a huge analysis of what that census tract map looks like around the state. We're happy to report as of yesterday, we've actually exceeded our goal, and now we're going to expand that to the top 100 census tracts around the state. So we're doing that through pop-up clinics. We know that not everyone has a healthcare home. Many of the people on this call, including myself, have an ability or a relationship with a local hospital, a local provider. Not everyone in Colorado has that relationship. So we need to take this vaccine to them, and we're doing that through pop-up clinics around the state, through help with our community partners as well. Those pop-up clinics could be small, could be 50 vaccines in a senior living facility or retirement facility. It could be 400 over the course of the day, like we saw last weekend at St. Cajetan's Church in Southwest Denver. So the goal, the strategy here is to make sure that people have vaccine and make sure that it's not difficult for them to access, and make sure that we're coming to them so that they have easier access as well.
Rick, thank you. I can tell you from the nonprofit sector side of things, it has been fabulous to watch the partnerships that have been happening across the state, again, with our healthcare providers and the understanding of not having people come to us, whatever us is, but rather all of us to, so to see those pop-ups have been, and Mile High United Way is very proud in April that we will be sponsoring a pop-up clinic for childcare providers as well. So we appreciate exactly what you're talking about. And Rick, to that end, you alluded obviously to thinking about families and children. We are seeing a lot of debate, and Dr. Price, this might be for you as well. We have a lot of parents on the phone that are watching school districts approach this in different ways, some going back and setting a date, others. What is any advice for parents or what you might be seeing around school districts and kids going back to school?
Yeah, I know it's controversial, but I feel that these kids need to get back in school. I have children in DPS now, and it concerns me, the isolation of these kids. And so we need to make it a priority, and we now have a tool. We have vaccine that is available to our teachers, and that's for me, we can get our teachers vaccinated because some of them are at high risk for illness. And so we get them vaccinated, we can get the teachers back in school, still provide some good social distancing measures and good infection prevention. And I think we can do it. And as the data allow and as the supply allows, we can start considering having some of the children vaccinated. But as you know, they actually, in general, don't experience a severe disease. So we should feel comfortable that we can do this.
And it is a huge priority of the governor is to get kids back in the classroom. As I mentioned, women in the workforce is a huge problem. Just the mental health, the well-being of our kids is so much better when they are around their friends, when they have an ability to learn face-to-face, which is why the governor has prioritized teachers. And I think by the end of this month, we should have made available vaccines to all of our school districts around the state, which is incredibly important.
Thank you. Thank you. We have a couple of questions about, one of the questions is about long haulers. And are we seeing, Dr. Price, I guess between the vaccines, or is there any research done yet on the vaccine's impact on what we're all beginning to understand are called long haulers around COVID? And a second question around that, do you see a difference between the three different vaccines in terms of side effects that one may have different than the others?
Well, the idea is to prevent infection, so we have no short haulers or long haulers, right? So the vaccine will be effective at preventing that potential long hauler syndrome that none of us want. In terms of the variants, the encouraging thing that we've seen with the vaccine is that they are all effective against these variants. But you know now it's a race for time. So we don't have a huge hold in Colorado right now from these highly communicable variants. We've had a few, but it hasn't taken hold. So now it's us versus that virus. We need to get people vaccinated before that can take a hold, because then it will spread more rapidly, and even in a vaccinated population potentially have the ability to infect. But if we get ahead of it, when we can produce immunity and prevent transmission, I think we can prevent these more communicable strains from getting a hold in our community.
Thank you. So Wade, I'm going to turn to you for a minute, because we know the past year at Mile High United Way, we've seen through all of the direct programming that we do, being supported by all of our Tocqueville members, that has had a huge impact, and we've seen that no more clearly than through what's happened at 211. So can you give us a little idea about what our own data is showing us and what we've been experiencing through the 211 call center?
Yeah, the past year has been quite a ride, I would say, with 211 would be an understatement. In terms of what's changed since COVID, I don't know that things have changed. Things have multiplied, I guess, and our services and our staff and our reach has expanded. We've had the opportunity to help so many more people than we would have before, and people who are in need in our community. So as the crisis grew, and Governor Polis announced our 201 Help Center as the statewide first response line for human service needs related to COVID, we experienced a rapid and unprecedented increase in contacts for resources through the Help Center. By the end of March of 2020, after the first stay-at-home order was issued, our contacts had risen to more than 2,100 daily. That's a pretty big increase from our average of about 330 a day. Throughout the fall, 211 saw a steady rise in contact volume, and in December, with many of the benefits expiring and new shutdowns in place, contact volume again increased steeply. If we look at the needs, I think there's a next slide on that. Similar to the previous maps you've seen today, our clients who call 211 tend to come from areas of Metro Denver that also have the highest need and that have also been hit hardest by COVID. This map shows that most of our clients in the metro area are calling from 5 Points, Southwest Federal Corridor, Aurora, and Thornton. Within this increased call data, we see where our community members need resources the most and who those callers are. As you can see here, most notable in terms of request, I think, there we go. The need for rent and utility assistance has risen considerably. Since March of 2020, 211 responded to over 17,800 requests for rent payment assistance. Assistance with food, meals, and other housing needs remain two of the top 5 areas of need, increasing in proportion with the volume of calls as the first shutdowns occurred due to COVID. Our 201 navigators, the calls we take, we hear from the single mother who's lost her job and was not sure how she was going to pay her rent and keep her family housed. We've talked to an elderly gentleman who wasn't sure where to get his next meal, and people of all ages who were in fear of leaving their homes and didn't know the latest COVID regulations and were scared and alone and frankly just needed somebody to talk to. We've taken calls from essential workers that need help finding childcare, and small family-owned business owners who were on the brink of shutting down, and community members in need of transportation to apply for benefits, to apply for new jobs, to find food, or just to get a COVID test. And we also took calls from landlords who haven't received rent from their tenants and are struggling to keep up with their own bills. Through all this, I would say our commitment to families has never been stronger. Since our volume is greater than we've ever handled before, we've made investments in infrastructure on both the internal database and our external public-facing sites in order to respond to the need. And while at first we did have to recruit staff members from throughout the organization to help answer the increased calls, we've now staffed up to support the community more effectively. And more recently, we've also developed a strong emergency response plan so that when these crises hit in the future, we will be more ready.
Well, Wade, it has been, as someone who has watched your leadership and do all this, it is. I hope it gives our Tocqueville members great pride in what they invest in when they join in Mile High United Way. But Rick, I have to tell you, our #1 partner in us being able to provide these services has been the governor in the state of Colorado. So, Rick, when sixth generation Coloradan, when we were talking earlier, probably this was sort of nowhere in your career plan to lead the way on this. What has been the biggest learning for you personally over this past year?
That's a really great question. I will tell you that that for me, I've had a couple of moments that have been incredibly impactful personally. The first is that regardless of whether or not you have a pandemic going on in a state, the state government still needs to run, right? We still need to be doing and offering all the other services that a state should be offering. And I think the stark realization that happened to me personally, just a memory, the most memorable day, I will say that, is that while I was serving as chief of staff, which I did for 4 months when Lisa Kaufman was on maternity leave, we were right after our Labor Day spike, where our cases were beginning to rise. And at the same time, we had about 200,000 acres of Colorado forest on fire, which was a battle unto itself. And I remember spending the day, you're not in an office, right? You're at your dining room table, you're at your living room sofa. So there's no real team around you other than the people that are sitting across the camera from you. And I remember thinking that how much worse can this possibly get with a spike in cases and things on fire and unable to do much about either at that time. And I got a telephone call from our director of human services, which is regular for them to report out things. And the telephone call was that there was a 1-year-old in my hometown who was in foster care, who was taken by ambulance to the hospital because he was beaten and ultimately died. And it was like a 1,000-pound weight was dropped on my head as a just reminder that there are still tragedies, individual tragedies that happen that we need to deal with as well. It's not just these things that everybody sees on a day-to-day basis. It's these small things as well that people were dying from other things. Tragedies were still taking place, and we needed to manage those things as well. So probably my most memorable day, the saddest day over the last year. The happiest day was on the 4th of January when we got 200 doses of Moderna vaccine into the town of San Luis, which is one of our most highest low income communities around the state. It's not close to anything except Alamosa, which is an hour plus away. And we got 200 doses to their community clinic valley-wide. They worked together with the fire department and their sheriff's department and volunteers, and they were able to vaccinate 200 seniors at the very beginning of the year in a town of 600 people. Mm-hmm. And that feeling, I think, brought so much joy to the entire team, because you realize that you are liberating people, especially seniors, who really have not been able to see their families for an entire year. So 2 memorable days, I will tell you, over the last year.
Thank you, Rick. It has 2 very memorable days that you just described. And as I've said numerous times throughout this morning, I am so grateful we are all in the state of Colorado. And again, the exceptional leadership. And thank you, Rick, for what you have done for all of us. And Dr. Price, I don't think you can ever hear it enough. It is the healthcare heroes, the researchers, the docs, the nurses, the folks that keep us all safe. I don't think any of us can ever say thank you enough to what the healthcare industry has done. Truly, there's a reason called healthcare heroes. How has your life changed in the last year?
Wow. Well, it has been a year like no other. I think, I worry about our healthcare workforce. And I don't know if we have that slide on provider burnout. I just want to put that up there so you all are aware of this, this phenomenon. But we, early in the pandemic, healthcare workers were disproportionately affected from COVID. And, May 2020 data, there were 300 healthcare workers who died. And then, at baseline, healthcare workers are struggling. Physicians, estimated 300 to 400 physicians die by suicide every year. So this is at baseline, where you're in an industry that is really struggling right now for a variety of reasons. Regarding COVID effects, even in China, data showed with the COVID-19 outbreak that 50% of the healthcare workers showed signs of depression, and fewer showed signs of anxiety. So we really do appreciate all the outpouring of support from all of our community in really just giving us that moral support to get through this. I have a picture of this incredible like food provided in our ICU in our break room. You can see we're piled almost chin deep in meals from our community. And it is just so nice to be able to go in and feel that love from all of you and that community support. So thank you.
Thank you. So I have a final question for all three of our panelists. And again, I can't thank all three of you enough for joining us this morning. This has been one of the most insightful conversations I've been lucky enough to be a part of. What is it that we as Coloradans can continue to do? And what are you most hopeful for all of us? So Rick, let's start with you.
I will echo the message that has been echoed 10,000 times over the last 12 months. That is to make sure that we continue to wear our masks. It sounds simple, to continue to social distance, and to do our best to try to stay away from people for the time being that don't live with us. I think while we wait for vaccines to get into arms, that is what all of us can continue to do. And also to be patient. We are in the undertaking of the largest logistical operation in the history of mankind, is to vaccinate the people who live on this planet, especially those that are most at risk. That's going to take some time. So I would just say to my fellow Coloradans and to everyone, we will get to you. It may not be tomorrow, it may not be next week, but you will have your chance to be vaccinated. And until then, have grace with your healthcare providers, have grace with the people that are around you, and just continue to be as responsible as we've been for the last 12 months.
Thank you. Dr. Price.
Yeah, I'm wondering if I could get the vaccine administration demographic slide up. This is what I am hopeful for fixing in getting our vaccine distribution. We have inequities. What I'm going to show you on this slide, if we can get it to come up, is that we do have a higher percentage of our white population getting vaccinated versus what percentage of the population that they represent. And likewise, our Hispanic population, representing about a quarter of the state's population, only 5% have been vaccinated. So we need to flip that. We know that there are inequities in cases of COVID in our families of color, and this slide shows that, and the hospitalizations show similar trends. So we need to fix that. And if we could go to the slide on the mobile health clinics. I'll show you this. Here's the targeted neighborhoods where we have high hospitalization rates and high death rates that we need to get to those communities. And then this is one of the ways we're doing it. And again, we appreciate all of your support in helping us do this. We go to these communities and, it is amazing to how welcomed we are. And it also, I think, engenders trust, when you're there with the people who, and they're getting vaccinated together. It also will encourage higher vaccine rates. So, we need to take care of each other. We need to make sure that we're all getting access to this vaccine, because that is how we're going to end this pandemic. And at the end of the day, that is what I'm most hopeful for.
Thank you. Thank you, Dr. Price. Wade.
I think my hope is that everyone here will share that 211 is a resource for our community, that when you call 211, there's a committed navigator there who's going to do their best to answer a question about a vaccine availability and more, offer those wraparound services to help with a specific situation. So my hope is that we can be there for everyone who calls.
Thank you. Thank you, Wade. And I am just going to end where I started. I couldn't be more grateful to be a Coloradan, and I think Dr. Price, Rick, Wade, you are just three examples of why I'm so proud to live in this state. To all of our guests this morning, our Tocqueville donors. Thank you for believing in Colorado. Thank you for believing in Mile High United Way. And Connie and Rick and Wade, thank you for such an amazing, amazing conversation this morning. We appreciate you taking the time and to giving us so much hope. We will get through this together. We know we have more work to do, but we will do it, Rick, with patience and with grace. So thank you to all. Thank you for joining us this morning.
Thank you so much.